Yes, good evening.
Good evening, everyone, and good evening, sir. Today, I'll introduce our speaker with us, Dr. Gulab Tewani, who is currently working as Chief Medical Officer and Professor at Sant Ram Yoga and Nature Cure Hospital, India's first NABH accredited teaching hospital attached with Medical College Sant Ram Medical College of Naturopathy and Yogic Science, Bhopal, having 10 years of experience. I welcome you, sir, on this platform. Thank you so much, sir, to come on this platform.
Thank you. Thank you. Thank you so much. Thank you. Yes, so I'll just share the screen with all.
Sure, sir.
Shall we start or wait for
No, sir, we will start,
some
sir.
more?
It's time, sir. 5 o'clock, sir.
Okay. Yes, this is fine.
Yes, sir.
Hope
It's
all are
visible.
able to see the screen.
Yes.
Yes. So today's talk, we are going to have basically on the naturopathy principle and how these principles we are going to use in our clinical practice. So basically, if you see about the foundation of naturopathy as the unity of cure and unity of disease, we have studied, and there is only one cause of disease, and there is only one cure, which we have understood based on the traditional theories. But if I will just go with the foundations basis of naturopathy profession, we need to understand two things. One is philosophy, and the other thing is the principles. Because if we know the philosophy, then only we will adhere with the principles and adopt the principles and implement into the practice. So we have heard about the vitalism, that is the vitality. Basically, we work for the vitalism philosophy, and also the holism. Holism is the complete. We are treating the patient as a taking as a whole. We are not giving just a symptomatic relief or the only based on the symptoms. We are not treating, we are just taking all the organs together and just providing the treatment accordingly. So the vitality or vitalism is basically the originated from the American schools of naturopathy in New York, founded by Benedict Lust. And this is this vital force is basically uh, the the helping in the normal functioning of the cell or the organ. Because as we know, the medical graduates, we know that cells, the one unit of cell is the structural and functional unit of the life, and the group of cells form the tissue, and group of tissues form the organ, and then the organ system. So one cell, even there is a vital force triggered to the functional normally that cell or not. So that is depending on the vital force. But when we are talking about the principles, naturopathic principles, these are the two foundations, that is the vitalism and the holism. And there are six principles which a naturopathy doctor has to follow by prior giving the treatment to the patients. Because these six principles are the foundation, and these six principles are: first, do not harm. Because based on this naturopathic principles only, we are going to treat the patient, and how we are going to implement that, we need to learn it today. So today's class, I'm really thankful to Bhavit that he has given and such an opportunity to interact with the BNYS graduates, so that even they can learn with the new technology, by sitting in all over India. So this basic six principles: first, do not harm; then the healing power of nature; treat the cause; treat the whole person; naturopathy doctor as a teacher; and disease prevention and health promotion. See, basically, these all six principles we have studied, but nowadays they are practicing the seventh principle, that is the wellness. So naturopathy and yoga graduates are more into the wellness field. So that's why this sixth principle also we need to adapt, that how we are going to implement practically in our day-to-day life when we are consulting the patients and giving the treatments to them. So as the first principle, first do no harm. Our therapies are dedicatedly practiced to regenerate, to recuperate, not to harm. None of the therapies are going to harm on our body, that we have to adapt with this principle. And also there is a healing power in the nature itself. It is not that that something from outside is going to heal the body or heal the disease or heal the cell. It is the healing power which nature has provided us and which is present inside the body, that we need to have firm belief on it. Then treat the cause. Usually nowadays, if you will look into the practices, everybody, all the physicians, either it is naturopathy physicians or homeopathy, allopathy, anyone, they are just running behind the symptomatic relief. We don't understand why they are running behind the symptomatic relief. Why? Because see, until and unless you work on the cause, the root cause, until and unless you analyze the cause, what is the cause for this problem, you are not going to treat patient completely. You are just going to give the symptomatic relief. So that's why the third principle you need to adopt, that first you identify the root cause. I'll just give you the example, like gastritis. If you find in day-to-day life, lifestyle disorder like spicy food is causing the gastritis. Now, apart, if you go on giving the medicines, antacids, it's not going to reduce the acidity permanently. The moment you eat spicy food, give antacid, normal. Again, moment you eat the spicy food, give antacid, normal. But until unless you remove the root cause, which is the spicy food, junk food, or fatty food, you cut down that, you are not going to cure it completely. In naturopathy, we believe, very much we believe, the definition of cure, which is explained as per our naturopathy text. What is cure? Cure is just a readjustment from abnormal functions to normal functions. We need to readjust from abnormal functions to the normal functions. Then treat the whole person. Don't specify on one particular organ. Why? Because when the detoxification process you are going to do, when the unity of cure principle you are going to apply, at that time you need to eliminate the toxins or the end products from the body based on four eliminative channels. So you need to activate all that four eliminative channels. Then naturopathy doctor as a teacher. See, you are doctor, you are not first doctor, you are first teacher. Why? Because patient will come, he will sit with you, he will have a consultation, you will give half an hour to 45 minutes of time, which is going to make you understand what is the problem he is suffering with, what are the causes which are contributing to fall, that person is falling ill. Because until unless you are not able to understand the causes, you are not going to resolve it. So this you need to understand. You have to behave like a teacher and then doctor. Of course, you have to give the teachings of lifestyle modifications, also the activities from morning to night, what the person has to follow in dinacharya. So dinacharya is very important. Nowadays we are not explaining dinacharya to the patient. Just patient is coming like allopathy doctor. We are just giving the prescription and sending them back to the treatment sections and giving the treatment. That is not the way of treating. If you need to adapt these principles, you need to implement into the practice. Then disease prevention and health promotion. Prevention is always better than cure. We are keep hearing about this phrase, this sentence, and until unless we believe that yes, prevention is going to help us or give, it is better than to cure thee. So prevention, always believe that preventing any disease is a best cure. So not to get disease. How not to get disease is based on your immunity and the immune system and the resistance power what you are having or what the individual patient is having. Based on that, you are going to decide that how many days treatments we are going to plan and how many within how many weeks the patient is going to get recovered completely. So accordingly, you are going to do the selection also. The seventh principle is the wellness. More people, they are just adopting naturopathy because they don't want to fall ill, and as their luxury life, you can say, in most of the homes nowadays they install steam bath, jacuzzis, and everything. So it is a part. It's going to be a part of wellness. The one thing when the patient is coming to you, what you need to ask, my patient is permanently tired. If patient is coming and telling that I feel tiredness, you need to ask why. Patient will tell you the reason. They don't sleep well at night, ask why. What is the reason? What is the cause? Until you are not asking this why, you are not going to get good outcome, or you can say the patient is not going to reveal you the truth why he is suffering with the disease. So you need to ask certain questions in the clinical practice so that patient will give you the answer accordingly. Then you need to interpret that what factors are influencing on health and disease. So these are the factors which is going to affect your health status. So once you ask about the sleep pattern, they will tell, no, we are stressed or worried. Then again you ask why you are stressed, why you are worried. Patient will go on telling you, revealing you the information that the eating habits are not good. Then again ask why it is not good. At last you will come the because of stress everything is resulting. So here you can mark out that stress is the major cause of the disease. Why? Because finally you are resulting in that condition. This stress is going to affect your health status. You can result into the health and disease. As if you all are aware about the definitions which we study in our first year PNC, that is health and disease. So health is normal and harmonious vibrations, right? So vibrations are basically Pancha Mahabhutas, five elements, that is Prithvi, Aap, Vayu, Akash. If these five elements are in balanced situation, then there is a health. Opposite to the health definition, there is a disease. Disease is not merely an absence of disease, but it is an imbalance, inharmonious vibration of these elements. So if these elements are imbalanced, then the disease will result. Now, these are the factors which can make healthy person as a healthy person or the diseased person. Now, personal essence, genetics, lifestyle, social, environmental factors, external factors, physiological or medical intervention. Try to understand in the basic concept that there are antigens, there are antibodies. So one way I will give you the example. If you name the toxins, there are two types of toxins. One is exotoxins, another one is endotoxins. Exotoxins are the toxins which are coming from outside to the inside body. And endotoxins are the metabolic end products which are being generated within the body itself, but they causes toxicity. Now this toxin is basically a culprit. This is going to cause the disease. So if I will make you understand based on the naturopathy concept, you will be able to understand very easily that how these principles we can implement into the day-to-day practice. So violation of nature's law, basically violation based on the breathing, the natural living, dressing, working, resting, all these can result into the primary and secondary causes. See, everything we have studied, I am just giving you an outline to understand, to brush up your knowledge once again. And the primary causes, there are three causes: lowered vitality, abnormal composition of blood and lymph, and accumulation of morbid matter. See, when there is an depletion of vital energy or depletion of nerve energy, then only the abnormal composition of blood and lymph will result. And once the abnormal composition of blood is resulting, then the accumulation will start within the body. So the primary cause, we need to understand why the person is falling ill. The secondary causes could be heredity, pathogen, allergen, traumatic injuries, mechanical subluxations. These could be the secondary causes. But the primary cause of disease is very simple, which you need to understand. It could be lowered vitality, could be due to overwork, night work, overstimulations, or ill-advised or surgical operations. Even the abnormal composition of blood and lymph can result based on the wrong combination or improper selection of the food, or the acidic and alkaline food imbalance can also result into an abnormal composition. Whereas the third, accumulation of waste and morbid matter, can result due to your faulty food habits and also resulting due to the overeating. So this could be the secondary causes like heredity, germs, bacteria, and even the fever, inflammation, mechanical subluxations. These are the causes. So I'll just given you the outline about the causes. And yes, of course, you all are well aware with the upastry. So this is the root cause, the violation of nature's law. Once the person is violating the laws based on the ignorance or the self-control or the indifferences, this can result into the trunk, that is the primary causes, and further it can result into the diseases. So either it could be the first initial phases, there will be the acute disease, then it can result into the chronic disease. Whereas if you will try to understand the process by which diseases is caused, which was explained in Toxemia, the basic cause of disease, written by John Henry Tilden, published in 1974. The process by which the diseases are caused. So this is based on the naturopathic principles. We will just move forward also. We will just compare with the modern medicine also. So this is the stress which is resulting due to the daily habits, or it can result into the strain, then depletion of nerve energy, then also affecting all the four eliminative organs, that is lungs, bowels, kidney, and skin. When there is a depletion of nerve energy, insufficient elimination process, when toxins are going to get accumulated within the body, it will go on resulting into the toxemia. And this is the initial stage of disease called as acute and chronic crisis. We need to understand the other part of the disease formation, that is wrong eating habits can result into the acid fermentation. Also, it can result into irritation, inflammation, ulceration, and further destruction into the chronic conditions. See, these are the principles. Now we will try to understand how the cell health is important to maintain the whole body system's health. One individual cell, if one cell is healthy, your whole individual body, human body is healthy. One cell is disturbed, diseased, impaired, whole system is going to get affected. Just need to try to understand. See, I have just given you the few examples which we study in our physiology, that the lifespan of the various cells. So red blood cells every 120 days gets new, or you can say the shelf life of the RBCs are only for 120 days. The stomach cells, every day it changes. Then the skin cells, every day new skin each month will be replaced. Then liver cells every year. Muscle cells rarely divide, just grow. Nerve cells rarely divide after birth. This is the lifespan. Long-lived is the smooth muscle, cardiac muscle, and the skeletal muscle, neurons. Only the smooth muscle can divide, but other cannot divide. Now, this you try to understand. This is the bone marrow. In detail, I will not go. I'll just give you the superficial, the touch of the physiology, so that we will be near around our foundation. Now, this is the bone marrow, hematopoietic stem cells, which are placed in the bone marrow. There are two classifications, that is myeloid cells and the lymphoid cells. Myeloid cells are going to form platelets, eosinophil, basophil, neutrophils, and monocytes, and also the erythrocytes. Whereas the lymphocytes, T cells, and B cells. Now, what role they are going to play based on the principles what we study. This is the example, the beautiful example for the self-healing, or body heals itself, or the healing power is in within. See, if there is a simple skin wound, if there is a small wound, it heals by itself. The system is within. The healing process take place physiologically, and which is installed by God. It is not being advised from outside. So only there is a wound. If wound is bigger, the doctor is going to put the sutures, and after closing the wound, doctor is not going to heal the internal damage of the skin. The skin cells grow by itself. The healing power of nature is going to heal this skin. You can see the healing of wound, how it is going to take place. The epidermis, dermis, if there is a wound, fibrin clot will be there, then there will be the proliferation, remodeling, and the larger the wound is going to be healed. So this is the process, how within the body it is taking place. So this is the best example for body heals itself. Now, take it the other example of the bone fracture. What doctor is going to do? Just going to provide you the rest to the bone. He's going to put the plaster of Paris for 40 days. What will happen when the doctor is providing you the plaster in the fractured bone? The bone will start growing from 0 to 3 days, 3 to 5 days, 5 to 10 days. Then finally the hard callus will be formed on 16 to 21 days, and later on it is going to heal completely. This is the best example to understand the healing power of nature. Doctor has provided plaster in order to provide you the rest. So basically the rest is curing. You are providing the rest. There is no movement. When there is no movement, this bone is healing. So rest is going to enhance the healing process. Doctor is not providing you anything, any supplement or the healing medicine. It's just giving you the supplemented food. And if diet you correct it, definitely you are also going to supplement it. But only the fractured bone is getting plaster because that bone needs a rest to get cured. Now this was this earlier I have explained you. Here you can just find out the immunity which we get it from or we get it by birth. That is the innate immunity and the adaptive immunity based on the T cells and the B cells. B cells, the lymphocytes, are the plasma cells. Now here what I have focused, basically the neutrophil, eosinophil, basophil, and monocytes. They are going to work in the process of inflammation. So we need to understand what is this inflammation and what is this innate and adaptive immunity. Innate immunity, the first line defense is the skin, the mucosa, and the normal microbiota, and the second line defense is the phagocytosis, the phagocytes, neutrophils, eosinophils, inflammation, fever, and antimicrobial substances. So here inflammation you mark out. Why? Because here also we have focused here in second line defense also, because first line defense is automatically, you need not to do anything. Skin is there, it's going to protect the entry of pathogen, that it should not enter it until and unless there is an wound. But the second line defense inside the body, how this entry of pathogen is being stopped. Then adaptive immunity is the third line defense mechanism, and this is based on the T cells and the B cells. So here the second, that is the inflammation. We will just have a short brief note on inflammation. What is inflammation? See, inflammation at the root of most diseases. Try to understand. When these toxins inside the body, they are not eliminated from the body, they run through the circulation. When they run through the circulation, then these toxins will identify the weakest point of the body and get deposited in that area. if it is going to deposit into the knee joint, that is they are going to find the osteophytes. So at that level, the pain will enhance or the circulation will be altered. So try to understand there is a healing process going on in inflammation. It's not a disease condition, but it is an healing process. Body is trying to heal itself, but we are not providing an opportunity. That's why the acute reactions can convert into the chronic diseases or chronic inflammations. See, these are the all diseases which are, just name it, and we very well know. You all also know that itis is going to represent the inflammation. So name it: esophagitis, sinusitis, laryngitis, pharyngitis, gastritis, osteoarthritis, anything. It is the inflammation process. Only the stages are different. That is the acute and the chronic. Now, if you will find, this is the local response of the living tissue to the injured part. Wherever there is an injury, the living tissue is putting some response based on the exogenous causes and the endogenous causes. And these are the sign of inflammation, that is the redness, swelling, pain, and heat. So this is the way of diagnosis, when the patient is coming to you and projecting the knee joint in front of you and asking, doctor, I have a lot of pain in the knee joint. So what you will do, you just see the temperature, you just see the movement, crepitus sound, and if there is a swelling, if there is redness, then you will identify, yes, there is a inflammation process going on. Now, in this healing process, what we need to do? We need to assist or we need to suppress. If you go to the doctor is prescribing you the medicine, then this process is getting suppressed. But if he is coming to a naturopath or the physiotherapist or the yoga therapist or the yoga doctor, he is just going to assist the healing process, the inflammation process. See, very well know two types, that is the acute and the chronic. If there is a stimuli, the immune helper cells do their job of healing and end the stimuli. This is the acute reaction. If you talk about the chronic inflammation, then it will ongoing process. It is an ongoing process. Repeatedly, you are getting the stimuli. When you are getting repeated stimuli, it's going to affect the joint. Why? Because you are ignoring the stimulus. You are just putting some of the painkillers. So what is happening? Repeatedly that stimuli is going to increase the cycle and pain persists for longer duration. And this longer duration is going to result into a chronic disease. Now, these are the examples of a few of the allergic reactions, chemical irritants, infections, trauma injury in the acute inflammation. Whereas the chronic inflammations, again, it will result into a chronic diseases. Now, this is about the medicine part. I will just come to the foundation of the naturopathy. See, inflammation we study in naturopathy, how it is going to affect to the healing process, that also we know very well. So let's brush up with the naturopathy inflammation, how this is going to work in our body. So basically the inflammatory process, what we believe is natural, orderly and lawful as anything else in nature. We find this as the normal procedure, and it should not be suppressed by the poisonous drugs or the surgical operations, because once if it is suppressed, then only it has an opportunity to reach further into the chronic disease. So the inflammatory process can be kept into the safe limits. These are the 5 stages: the incubation, aggravation, destruction, abatement, and reconstruction. What happens in incubation phase? Incubation is the exposure, the external, the organism or the pathogen is entering inside the body, and bodies respond to that pathogen. Is the time duration between that, it could be several hours, days, few days, months, or even years. If this is the condition, then the incubation phase progress. Now, when the phagocytes on one side and the nature's healing, the nature's antitoxins on the other hand, the poisons and microorganisms of the disease on the other hand, is going to fight in the aggravation phase. The symptom of aggravation phase is the fever. The first initial symptom based on naturopathy, we believe there is a fever. So it should reach its climax. Why? There is a fight going on between the healing process and the disease organism or the toxin. Now the destruction phase will come. In this destruction, the disease force, the force of disease and the healing force, they start fighting together. There will be some of the tissue damage, some of the cell damage, accumulation of the exudate, resulting into the abscess, boils, or fistula formation, open spores, and even these blood vessels also get destroyed in the field. This battlefield, debris of battlefield should be clear so that the abatement phase should start and reconstruction phase should come. Now, the abatement phase is only based on the lowering down temperature. Why? Because the damage is what it has taken place in the destruction phase. Now, this is going to absorb from this and come into the lymphatic circulation and get eliminated from the body. Now, this destruction phase should result into the abatement phase, that is absorption and elimination of exudate, pus formation, and lowering down the temperature. So lowering down the pulse rate will take place and it will subside other symptoms of the inflammation. Then the reconstruction phase will start. In this, whatever the obstructions will be there, it will be cleared off. Work of rebuilding is going to start. Organ begins to work again. The blood vessels which was damaged will undergo repair mechanism. The healing process and reconstruction will take place on the injured part. This is the normal procedure what we have studied. In case if there is an suppression, then there is a problem. Then the acute diseases will convert into the chronic diseases. Then we are going against to our naturopathic principles. If we are supporting that principles, we should believe there is a healing power in the nature, in the body itself. What we need to do for this? Just try to understand, should not be suppressed with the poisonous drug, should not be suppressed with the wrong treatment, should not be suppressed with any of the unnatural methods of treatment. We just need to clean this destructed cells and undergo the healing mechanism and regeneration process. But if we suppress, then what happens? If you suppress in first two stages, it will not have a fatal consequences, but yes, this will build the foundation for chronic disease. Then if you suppress the destruction phase, normal nutrition and functioning will not be able to reach to that particular cells, and this will be left out in that situation in the destructive phase and left permanently in the cell destructed region or that particular area. Then absorption phase, this symptom should get that the healing, the heating, heat, redness, swelling, and pain. These symptoms should reduce in the phase of absorption and reconstruction. Then only we will understand, yes, that there is a healing process going on. But now try to understand. If you are suppressing fourth stage and fifth stage, this will result into an chronic disease, because foundation was created in first two stages, and the chronic stage and degenerative diseases will be we will not be able to overcome with the degenerative diseases because we have suppressed last two phases. So one basic principle in naturopathy: never suppress any disease with any unnatural methods of treatment. Nature has given us 5 elements, constructed 5 elements. Use that 5 elements for the treatment. If you use that 5 elements for the treatment, you are going to overcome with the the disease with the acute phase and the chronic phase of the disease condition. The system of healing, very important to understand this system of healing is based on our gut health, the condition of gut. If your gut is healthy, the full GI, gastrointestinal tract is healthy, digestion is healthy, assimilation, absorption, and elimination process is regular, then surely you are going to overcome with the disease condition, and this will return into an cure form, that is readjustment from abnormal functions to the normal and healthy functions. The system of healing just give rest cure, that is fasting. Fasting is the best way to provide the good rest to the internal organs, that is the physiological rest will be provided only with the fasting. And Herbert M. Shelton has very beautifully explained how fasting can save your life. Everyone should read that book because you get in-depth knowledge regarding the fasting. Then bed rest, physical and mental and physiological rest, health building principles you need to adopt. When you adopt the health building principles, the health will return. And this we can apply to so-called disease either in an acute condition or in a chronic condition, but not in the destructive conditions or the degenerative conditions. Then natural methods of treatment, very basically, beautifully explained, which can be implemented based on the naturopathic principles. Dictum of cure. What is dictum of cure? What is the cause? Remove the root cause for treating the disease. So return to nature. Our human body is being developed based on 5 elements. Use that 5 elements, Prithvi, Aap, Tej, Vayu, Akash, for healing. If you give these 5 elements, the health will return. And remove the root cause, eliminate the toxins, detoxify the body. Nowadays, detox programs are at the good demand because people are searching where they can go and detox themselves and get regenerated in some of the naturopathy hospitals. Now, these detox programs are going on. Even the supplementation of vital nutrients. If you give good nutrition, then yes, you are nourishing the cell for repair and conserve the vital energy. So don't do overexertion based on violation of nature's law. Don't violate the nature's law. If you violate the nature's law, then this is the big problem. Then you will not be able to conserve the nerve energy. And once you are not able to conserve the nerve energy, your cell health is going to be damaged. And this cell health is going to affect the system health, full health. And the 5th, very important, is the rest cure. So the best way to implement 5 principles in our day-to-day practice is RX wellness model for this basic naturopathic principles based on 5 pillars. Should have balance between the healthy spine or the nerve energy based on daily movements and proper nutrition, giving good quality of sleep by enhancing rest cure and also mental attitude. So positive mental attitude. If one person is adopting these 5 pillars of health, we are adhering to our naturopathic foundation principles, and based on that principles, this is the model which we can use it for the patients and get good results by modifying the lifestyle, by changing the dinacharya. We can overcome with the health issues. So with this, these are the 5 pillars we can use, and this is the implementation of the naturopathic principles as a clinical practice which we can see. So hope you have got completely, and at last, if you need to be healthy forever, just uproot the root cause. Don't give the symptomatic relief. Don't be afraid of diseases. only uproot the root cause with the naturopathy, the natural 5 pillars. That is the 5 pillars what I have given you. And once you are able to uproot, definitely you are going to make people more healthier, more energetic, and yes, of course, more longevity or more long live. So naturopathy is the art of living. The best way to adopt naturopathy, use these 5 pillars. This will adopt our basic 6 principles, including the seventh one, that is the wellness. You are going to fulfill based on these 5 pillars. So thank you so much. These are my references. You can refer if you need. And if any questions, I invite now. Thank you. Thank you so much.
Yes, if any questions are there, they can unmute and ask to you directly, or they can write in chat box if they have any questions. So we will wait for a minute if anyone is typing.
Yeah, yeah. Yes.
There is a one question in the chat box.
Mhm. Yes.
Am I audible, sir?
Yes.
Yes. I'll tell.
Yes. There
From
is a
Abhishek.
question that yeah. So obesity is an inflammatory disease, and how inflammation works in the obesity. Um, Moreover, if you will see, the obesity is the lifestyle disorder rather than going with the inflammatory disease. But yes, if you will try to understand the inflammatory disease, see what is basically happening. It is the food habit which is not correct. Based on the food habits, the lack of physical activity, and also there is a problem on the metabolism. So what being a naturopathy physician, what we are going to do, we are going to correct the metabolism by enhancing the physical activity. On other hand, we are just doing the dietary reform, restricting the calories, and also giving some of the craving in the sense like you are restricting the calories to enhance the autophagy response. Autophagy response is again the abatement phase, and the reconstruction phase is going to be activated in the inflammatory condition. So based on the naturopathic principle, I will suggest if you will go with the three things. One is correcting the metabolism by enhancing some of the physical activities, and also again giving some of the dietary reform. This is going to help us to overcome successfully on the completion of abatement and the reconstruction phase, because there was a destruction. Now destruction needs to get abatement and the reconstruction. This can be achieved in that process. So just we need to change the lifestyle for them. And the second is which was the that book on fasting which you said. Yeah, fasting can save your life. Fasting can save your life. Hubbard and Shelton. So you can refer this book. It's also available online in on the PDF form, or even you can get it through the Amazon. Yes. Yes. Do we have more questions?
So maybe not like nobody have texted anything. So I hope it's clear to everyone
Okay.
what you have covered. So we'll conclude the first part of this session, sir. from you, sir. So thank you so much, sir, to come on this platform and share your experience, which is very basic, but which is not followed by every doctor. So they will understand and they will learn through this process and they apply in this clinical aspects. So thank you so much.
Thank you. Thank you.
So we'll start the next